Hello, hello, hello. Facebook, YouTube, Instagram. Welcome, welcome. I'm a little bit late. Sorry. But I'm here. Hello, hello. Instagram, jump right in. I'm waiting on. It's going to give a little bit of time to Facebook and YouTube to hop on too. Hello, Jay Frida. Hi, Cindy. Hi, Sheila. Hello, hello. Hi, Charlotte Jackson. Welcome, welcome. Where are you guys tuning in from? Hi, Latrell. Hi, Mrs. TJ89. Hi, Nettie. Hey, Diana. Welcome, welcome. I'm not staying on here all night with y'all. I'm gonna stick to the topic so it's not too long. It's late. Cali by way of New York. All right, sweet. Jacksonville, Florida. I love Florida. Houston, Texas. I like Texas too. I am located Gala 522223. I think I might have said one too many twos. I am located in Johns Creek, Georgia. We got a few people from Texas, Detroit. I went to the University of Michigan for undergrad. I used to, kick it on in the D on the weekends back in the 90s. Oh, I ain't staying all night. I'm gonna show you. Hey, Michelle Harris from Sanford, North Carolina. Are you new? That's a new name. Hey, Caramel Kisses too. That's a cute name. Oh, you were in ATL. Okay. We got ATL representing up here, South Carolina, Houston. Nice, nice. Dubai. What time is it there right now, Vivid Seven Dreams? What time is it? There's a lot of Texans here. Okay, so liposuction. Your Bible study crew, Diana. Oh, Diana. I thought that was you, Diana. But okay, so Diana, how come you ain't came over to the 40 days walking with Jesus crew? It's a good crew. We've been getting some steps in. It's 7:15 there. I'm talking about in Dubai. Oh, it's 7 a.m. Okay. 7 a.m. yesterday or 7 a.m. today? Okay, so it's the 15th here. Is it the 16th in Dubai? Or is it also the 15th? Oh, that's a good Hannah and Penina. Absolutely. I would love to talk about Hannah and Penina. Yes. Okay. I'm not going to do that tonight, though, because we're talking about liposuction. But I can talk about Hannah and Penina next. I kind of should have talked about those two on Mother's Day. Hannah and Penina is, yes, I love that. That's in 1 Samuel chapter 1. I know that story so well. It's the 16th. Okay, so you guys are ahead of us. Okay. Massachusetts. Um, I wanted to, but I couldn't commit all the way and didn't think I could. Oh, Diana. If I can do it, anybody can do it. Now, I ain't gonna tell you it was easy though. Shoot, most nights I don't finish my steps until like 11 o'clock at night, 11:30. They'll tell you I'll be posting my steps. I need to post my steps now. I haven't posted my steps in the group yet, but it'll be 11:30 and I'll be just finishing posting my steps. But I'm talking lipo tonight, Miss Cindy. Mississippi, nice. Is it better to have liposuction or tummy tuck after weight loss surgery? Not likely for most people who have weight loss surgery. If you lost a lot of weight, you probably need a tummy tuck. Probably. But I can't say that for sure without pictures. Every so often it'll be someone. See, it's late, y'all. Every so often it'll be someone who had weight loss surgery who literally legit just needs liposuction, but usually they need skin removal. Hey, Black Cherry 57. Yeah, go on to sleep, Black Cherry 57. I'm talking about lipo tonight. This is not Bible study. This is lipo chat. See, there's all my 40 days walking with Jesus crew on here. They're like, oh, you talking about lipo? We'll holla. Okay. All right. So here we go. Fibrosis. Yes, I can talk about fibrosis. Um, Let me grab a pen so I can write these topics down because fibrosis is a good topic. What about if on insulin focus on ability to improve lungs? I have A1C is good. Correct. That I agree, Sean B. That's my recommendation. With people with diabetes, you just need to have a decent hemoglobin A1C. With all this walking, I'm good. Listen, I've lost a few pounds. Black Cherry 57. I weighed myself tonight when I was up at the office, and your girl is losing weight, even though I'm not walking for weight loss. It's just a benefit. Can you discuss about boob lift without augmentation? Yes, I can do that. Hold on one second, lady. Okay, I was just grabbing a piece of paper so I can write down these topics people want me to talk about. Okay. Fibrosis, breast lift without augmentation. And then Hannah and Penina is in my Jesus column. Okay. Hey, Adeline. Okay. All right. So here we go. So liposuction, who's a good candidate is the question. All right. So when there's a few things to consider with any plastic surgery, and like the most important thing that I am paying attention to when I meet new patients, when I do consults, is the frame of mind of the person. So I need the person to be in a healthy mental state, like emotionally, and have realistic expectations, to not be obsessed with the outcome or obsessed with getting surgery. That didn't used to be so much of an issue before, but now there's a lot of people, because of the culture of plastic surgery, on social media. There's things that will help kind of feed interest to the point of obsession. Okay. So I'm actually paying attention to those types of things when I am interacting with the patient in the consultation, to make sure we don't have like some unhealthy frame of mind, because when people have that, it doesn't matter how good the surgery is, you'll have issues with them afterwards. Okay. So that's one thing. You need to be in a healthy frame of mind with realistic expectations, um, first and foremost. Then after that, you need to be healthy, relatively healthy. Okay. So if you do, it doesn't mean you can't have any medical problems. Like, if you have high blood pressure, it needs to be under good control. If you have diabetes, it needs to be well controlled. So someone just asked me, is it okay for me to get liposuction if I'm on insulin, if my hemoglobin A1C is good? Yes. Sorry about the yawning, y'all. It's 10:22, but I got to do this when my children are asleep. So yes, it's okay. Like, diabetes is not a deal breaker, but poorly controlled diabetes is. So your hemoglobin A1C, it doesn't have to be perfect, but it needs to be decent. So like my recommendation for liposuction is that your hemoglobin A1C be under 7. If your hemoglobin A1C is in the double digits, you don't need to be getting any elective surgery that's not absolutely necessary. Because the thing about diabetes is, when your blood sugar is just like chronically elevated, it actually, elevated blood sugars inhibits your ability to heal things correctly. It increases your risk of infections. And with the infections that you get with diabetes, it tends to be like the more dangerous infections, like flesh eating ones and stuff like that. You have a higher chance of getting like flesh eating bacteria when you have diabetes. The bacteria that grows in diabetics is not the same as bacteria that grows in people whose blood sugars are normal. So that is your health needs to be um in good control. Okay. When people have other well, all of my patients, even when they don't have other medical problems, I require clearance from their regular doctor. So if people are like, well, I don't have a regular doctor, can you clear me? I don't know you. So you can lie to me. You can tell me that, I had that happen a few times before. And then that's when I just kind of changed my policy and I require clearance from your regular doctor because they know all the stuff that's going on with you. And some people, they do get into this desperate place and they'll lie if they know that you're going to say no. So that's one of the things I just want to make sure a lot of times the stuff people are lying about, it's not even necessary. It's just, we need to know what's going on in order to make it the safest experience for you. And so if you're hiding things because you want surgery so bad, that speaks right there to your mental state. That speaks to your mental state because you're like, I don't care if this will hurt me. I just want this surgery. That's just not good. And so now you're putting you and me at risk when you do that. And so, I need you to be in good health and I need the blessing of your regular doctor. There was something else I was about to say on those lines. Oh, someone was asking if they're in good health, if they're overweight, is that okay? Okay. So my BMI cutoff for liposuction is 33 or less. A BMI of 33. So the body mass index actually is it basically takes into account your weight to height kind of ratio. And so so if you're 200 pounds and you're 6'2", that's going to be different than being 200 pounds and being 5'2", right? So it takes into account your weight and height and spits out a number. And a BMI of 33 is still considered to be obese. Okay, so I'm not trying to make people be skinny. But what I have found in my practice is that if a person's BMI is 33 or less, they are less likely to look at me at the follow-up appointment, 2 months later, 3 months later, sad, saying, I feel like I didn't see no difference. The bigger you are, the more needs to happen in order for you to see a difference that you can really, be excited about. Also, the bigger you are, the higher your risk of complications like necrosis, which is tissue death, infection, and injuries to like structures unknowingly, because sometimes hernias are hidden in people who are really big that you can't necessarily feel on exam because of the amount of fat they have and stuff like that. So when your BMI is 33, the complications are much, much lower. Satisfaction is much, much higher. And so I tend to go with the BMI of 33. It's not an absolute, but it's kind of mostly most people. If your BMI is 40 and stuff like that, you need to lose weight before you get elective procedures. You're literally, when it gets up into the 40s, it's almost a guarantee something's going to go left. So let me see. What was that question? Hey, Ministry said, can you get life if you've had uterine fibroid? Yes, it's totally not related. So the fibroids are in your pelvis, like deep in your pelvis. And liposuction is done relatively superficially. It's on top of the muscles and under the skin. So it's a different plane. Now, if you have really big fibroids, that might be the reason that your belly's sticking out. It might not actually be fat, in which case liposuction isn't the answer. but it isn't because fibroids hurt you. It's because the reason your belly's big is because of fibroids, and you can't liposuction away fibroids. How long do I have to wait between having 2 surgeries? It depends on what the surgery is that you had, like what the surgeries are. Thank you, Crystal Daniels. What is the name of the other procedure that isn't a tummy tuck, but you're still cutting the skin of the abdomen? Do that. You know, I play a part. A mini tummy tuck or paniculectomy? There's not a cutoff necessarily in Georgia, but I don't go by unless the state has a number. The amount of fat I take off depends on the person. It depends on the person's so when I'm lipoing, when anyone's lipoing, it's not just fat that comes out, blood comes out too. And some people put out more blood than other people. So I'm not going to chase a number if too much blood is coming out. So I'm paying attention to the blood loss and the fat loss when I am liposuctioning. So when people are like, well, how much can you take? Or how much are you going to take? Or you look at me, how much do you think you can take? I never tell people an amount, even though I may have an amount in my head, like a goal in my head based on what they look like. But I can't guarantee that I'm going to get that because it really depends on how your body is responding, because I'm not going to exsanguinate somebody to get to a number. This is how you end up with people like, going into cardiac arrest and dying on the table getting lipo because they might have lost too much blood. You have to have blood in your body. And if I suck it all out on a lipo canister, this could be a problem for somebody. You see what I'm saying? So hysterectomy and breast reduction are 2 surgeries. So talk to the doctor that the doctors you're dealing with. Okay. I don't know what went on with that stuff. And they'll let you know how much time you need to wait before you get another surgery. I only have bottom fat on my tummy. I want it gone. Should I do laser lipo with combination of exercise? You need to do exercise regardless. We need to do that anyway. Laser lipo, I'm not a huge fan of it. I used to do that and I stopped. I think it causes more scar tissue, and the amount of skin contraction you get with it is not all that impressive to me. So, but yes, that's an option. And it depends on how much excess skin you have or the laxity of your skin to determine if that's going to be enough or not. So when you say I have bottom fat, I don't know what that looks like on you. And so, yes, that could be an option. That's one of the options for people with what you just described. If you are considering surgery, I better go to her. She is a go. Oh, thank you. What? Okay, I answered that one already. Okay, so we have a person who is mentally in the right frame of mind, a person who is healthy, or if they do have a few medical problems, they need to be under good control. Like when people are coming in with like a list this long of their medications and stuff, it's like, this probably ain't the best thing for you to be worried about when you're, if you need all this stuff to make your body work right, we probably don't need to be stressing it with this unnecessary surgery. So we need you to be in pretty good health, pretty good condition from a health standpoint. Yes, I do lipo while the person is awake. It's Bria Janae. Yes, I do. Can you get a tummy tuck or lipo with a mesh in your stomach from hernia repair? Yes, you can. Now, so that's kind of like those are kind of like the housekeeping things that make you a good candidate. Like those are things that I consider regardless of what surgery you're getting, that's elective. Now for liposuction specifically, there's a few things that I'm looking at. One of the big things that I'm looking at is your skin. The first thing I'm looking at is, do you have pinchable fat on top of your muscles? Because sometimes people's bellies are sticking out or projecting or protuberant or look like a beer belly. And it's not because of fat on top of your muscles. It's because of fat around your organs. So I'm going to be assessing the amount of, it's called extra abdominal fat, the fat that's on top of your muscles, the fat that you can pinch when you grab your stomach, you can pinch it. That's fat that can be liposuctioned. Then you have fat that's deep in your abdominal cavity, and it envelops your organs. Sorry, y'all. That's called peritoneal fat. That fat you can't get to with a liposuction cannula. So let me draw you a picture. Some of you have seen this picture before, but it's hard to have a talk about liposuction and belly procedures without this image, because it really just helps put things into perspective. Okay. So this is, you can see, this is you can see the other stuff through this paper. This is my daughter's Spirit Week flyer. Okay, can y'all see the picture I drew here though, right? Okay, so this is like the skin. This is if you cut a person in half, like with a guillotine, okay? So this is skin. Okay, this is the fatty area, this white space. This is extra abdominal fat. Then you have your muscle layer, and then deep inside is where your organs are. So these little circle things represent your organs, okay? Peritoneal fat or visceral fat is around is in this compartment. You can't liposuction stuff in here. That's the fat that makes you look like you have a beer belly. This fat in this layer is pinchable fat. That's fat that my lipo cannula can get to, okay? So you need to have extra abdominal fat. That's the fat that we can get at with liposuction, okay? So I'm checking for pinchable fat that actually is amenable to liposuction. People would be like, oh, I can pinch it. And what they're pinching is a skinny pinch. Like if it's like a thin pinch, it's not really, that's still just really skin. Okay. So I'm looking to make sure they have enough fat to make liposuction make sense. You can't get to visceral fat with the tummy tuck. No. You know the difference by getting examined by the surgeon. That's your best bet to figure out the difference. So, first we're going to make sure you actually have fat that is amenable to liposuction. I mean, sometimes it could be from visceral fat or it could be from fibroids. I was talking about that earlier. So we have to evaluate the source of your belly sticking out. Okay. So then I'm going to pay attention to your skin. So if you have a lot of hanging skin and you've got deep stretch marks in it, then I'm going to, let you know, like, it's not likely that this skin is going to shrink. Somebody said she can pinch 2 tires. Me too, child. It's not likely that the skin is going to shrink. And so that's a discussion we need to have up front. Like, what are your goals? Some people are like, I'm not getting a tummy tuck. I don't want a tummy tuck. I just want my belly to be thinned down. I want to look better in my clothes. I don't care about the skin. I just don't like my belly sticking out. Okay, so now you're still a decent candidate for liposuction. I can deflate things to make it so that your belly's not sticking out, but you're still going to have some skin hanging. That skin will contract some with the liposuction, but depending on how much damage you have to the skin or how much is hanging, it may not contract all the way. So skin is a big factor and skin in relation to what your goals are for the surgery. It is not uncommon for people to come like, I just need to be smaller. I'm not worried about the skin. And they don't want to tell me that they're not trying to look like a Baywatch model. They want to look good in their clothes. Right. And so then I'm like, okay, I just make sure they know, listen, this skin is not likely to shrink all the way with this liposuction. They're like, I don't care. I'm fine. I'm like, okay, fine. So sometimes that's what happens. If you just have skin, but your belly is not, if you just have skin at the bottom, belly button looks pretty decent. You don't have a huge diastasis, meaning a space between your muscles that makes your belly stick out. And you just have a little skin at the bottom. We can do a mini tummy tuck just to cut that sliver of skin off the bottom with the liposuction. So these are some of the things that we're considering to determine if you're a good candidate or not. There might be one person who's like, I want it to be flat. I can't stand this skin, and I might tell them, you are not a good candidate for liposuction. There might be another person who has even more skin hanging than her, but she like, I don't care about the skin. I just really want this fat gone. I don't want a tummy tuck. I just want to look better in my clothes. And that person actually would be a good candidate for liposuction. So that's why what your goals are um, matters in determining what's the right surgery for you. You know, some people want to get improvement without having much downtime, and the downtime for liposuction is minimal. What are the effects of having this CAT scan to diagnose the problems? I heard CAT scans are dangerous. To diagnose which problems? I don't understand why we're talking about CAT scans. I don't think CAT scans are dangerous. Thank you, Lakia Tyler. Thank you. I believe I prefer lipo versus tummy tuck. Would this be discussed during the consultation? Yes, that will be discussed during the consultation. That's what we talk about. Your goals against the surgical options that would match that based on what you have going on to start. That's the main stuff. So you want to be mentally healthy. You want to be physically healthy or under good control if you have a few medical problems. You actually need to have some pinchable fat somewhere, you know, in the areas where you're trying to get improvement. Your skin quality matters. And so if you have nice, good skin that doesn't have stretch marks and stuff's not really hanging, it's just kind of sticking out because of the fat, that skin's going to shrink, you know. And then if I look at your skin and think it may not shrink, then we'll talk about that. So you can have a, you know, understanding of what you can expect after getting the procedure. The recovery time difference between a tummy tuck and liposuction. Liposuction, you're looking at about 48 to 72 hours and you can be back at work. A tummy tuck, at least 2 to 3 weeks before you can go back to work, depending on what your job is. If you're like a police officer, you might need 6 weeks before you go back to work. But most people's regular jobs where you're not doing something like that, 2 to 3 weeks is plenty. I see when you do tummy tuck, wind up a tattoo over scar. I cannot stand when people put tattoos over the scars. Sorry if somebody did that. I just think that's like the perfect way to tell everybody I had a tummy tuck. The scar from a tummy tuck is low and hidden. You literally can wear a bikini and nobody would see the scar. It's like, why go and put that? You know, that's not my thing. But Eric, to each her own. And if somebody like they tattoo over their tummy tuck scar, like it's fine with me. The pain level after lipo, that is a good question. So I have some people who don't even take the pain medicine, you know, and then if it's somebody who's not had children, I do not do BBLs. They're dangerous. If it's somebody who has not had any children and don't really know pain, they might be like, but you know, everybody's okay in a couple of days. It makes you feel sore like you had a rigorous workout. All right. I think that's it. That's all I really wanted to say. Answered a few questions. We're doing good on time. It's right around 30 minutes. This is perfect. So, if anyone would like to reach out to me for consultation, you can reach me. You can call my office Monday through Thursday, 9 to 5, Fridays, 9 to 1. My office number is 678 325 0006. Or you can or you can go to my website. You can click the link in my bio and on any of these places, and that'll take you to my website. Or the website is for consultation requests, www.drmylapowell.com, DRMYLAPOWELL.com. Can you lipo your back? Absolutely. Somebody said recovery process. The recovery process is pretty simple. The first 24 hours after the liposuction, I don't close the holes that I do the liposuction through. And so what happens when you put the garment on, it squeezes all that fluid out that I use to get you numb. And so you're a little soppy for the first 24 hours. So we have people put like chucks in their car or, absorbent things to keep you from soiling the seats and do it up, put it in your bed and all that other stuff. So for 24 hours, you're a little wet. Okay. Then after that, you take a shower 24, the next day you can take a shower. You come up to my office the day after the procedure for your first lymphatic massage. I recommend people get lymphatic massages at least weekly for the first 6 weeks. Some people need more, but minimum you'll get it once a week for the first 6 weeks. And like I said, about 48, 72 hours afterwards, people are kind of going on about their business. But you can't exercise or have sex for 3 weeks after the procedure, and that is to reduce bleeding complications. And then you have to wear your compression garment for 3 months minimum. I want some collagen and chocolate pudding. Sheila Posey, click the link in my bio, and I literally have in there the pudding and collagen in a little 2-pack together. Just click the link. Coming from out of town, you offer recovery locations. So I don't like recovery houses personally. I don't like them. So my patients stay at one of the hotels right down the street from the office. How long can I take off work for tummy tuck BBL? I don't do BBLs, so you ask the doctor that you are getting that from. Yeah, the hotel is fine after liposuction when I do it. And it's a few hotels right down the street from the office. Any other last minute questions before I sign off? Doesn't collagen go to the joints first? It goes everywhere. So the collagen, the collagen that I use is fractionated. So it's broken down into little bitty pieces. So when it goes over into your bloodstream, your body puts it back together and disperses it all the places that need it, which is everywhere. So yeah, that collagen, I literally love it. I can't even imagine. What did you sprinkle on your pudding yesterday? Actually, I think I have it right around here. I just saw it. What did I do? Oh, I got the phone propped up on it. Okay, let's see. This is the stuff that I put on there. It's a prebiotic. So it's got a prebiotic, a probiotic, and a postbiotic in it. And I love that stuff. It's it's a really great probiotic. So I usually sprinkle that on my pudding because it tastes like this. It's these little beads, and it's got the microorganisms and stuff in it, but it doesn't have much of a taste. But when you put it on the pudding, it tastes like a chocolate crunch. Like it tastes like dessert. So it's the best way to get it in. I don't know how other people take it. It doesn't say to put it on the pudding. That's just what I do. Take 1 scoop daily mix into a smoothie, sprinkled on food, or straight to the mouth. Yeah, the straight to the mouth thing is a no for me. Well, let me see what it's like taking it straight to the mouth. I never even tried to take it straight. Yeah, it has not much flavor. It's not bad, but it's not good. But see, when I put it on that pudding, it's good. This is on my when you click the link in my bio, it's on there separately. But I love this stuff. It keeps when I'm taking that every day, it keeps things regular. If you know what I'm saying. It helps with all of that stuff. I can do a collagen chat. I'll do one of the, maybe I'll do that. What do I have going on tomorrow? I actually could probably do that tomorrow. Tomorrow, I'll go over supplements tomorrow night. Okay? I'll go over supplements tomorrow night. When is the blackberry coming back? I don't know. Usually they'll do special flavors like that in around Thanksgiving. They always have some flavor that they come. But I don't know if it'll be blackberry again because they did that the last time. Been using it for 2 years. Me too, girl. I've been using it for 3 years. I'll never stop. I like this stuff. I don't care what anybody says. It's the good stuff. So I've been using it for 3 years to have no intentions on stopping. So tomorrow night, y'all, is collagen chat. Well, it's not just collagen, it's my supplements. But collagen, I just love collagen. Collagen is good for your skin. The pudding that we were just talking about, that one helps burn fat. So like most of my lipo patients take the pudding. And so with the pudding, you're getting your collagen dose. See, I don't like, hold on, I need something to drink. Like those little bees is getting caught in the back of my throat. That's exactly why I don't take it without the pudding. It was weird. Them little bees just floating around the back of my throat. I knew it. Okay, so tomorrow night we'll meet back on here and talk about the supplements, the collagen and stuff. Sounds good? Do you have to be put to sleep for lipo? No, you do not. All right. Okay, we didn't talk for another 8 minutes after I start saying goodbye. So we're going to go ahead and get off. I'll call y'all back tomorrow night and we can talk about supplements. It'll be around this time. Y'all know my times. I know I wrote 10. It's 10-ish. I have 3 little people. And sometimes I plan stuff and it go another way. So 10-ish, we'll meet up here. I'll call y'all back. And we'll talk supplements. Sound good? All right. I love y'all. Y'all have a good night. And maybe in the morning, I might talk about the lady who asked me about Hannah and Penina. Maybe I'll do that in the morning when I walk. We'll see. But tomorrow night, we'll talk about collagen. Okay? All right. I'm going to call y'all tomorrow. Love y'all. Bye.